Okay, good morning, student, once again. So today I'll be teaching you all on the topic shock. Okay, I'll be showing you all the screen. And I have already explained you all about the shock. And when I was explaining about the fracture, I already told you all the meaning of shock. Can you see the screen? Wait.
Yes, ma'am.
Okay. Okay, so can anyone tell me what was the meaning of shock, which I have like discussed? Anyone? What was the meaning of shock? And then we will directly continue with. Anyone? Any idea what was shock? I keep on repeating, right? That when someone will lose something, then that can lead to shock. What was that? Anyone? Anyone?
The condition when the person didn't get enough blood flow.
Okay, very good. Okay, so let you write the topic. Okay, shock. You just write the topic shock, and you write today dates. So shock, as we all know that shock, it is one of the critical condition. Okay, it is one of the critical condition brought on by the sudden drop in the blood flow to the body. So when there is a sudden drop of blood flow from our body, okay, or excessive blood flow from our body, that can lead to a condition which is known as shock. So shock may result because of trauma, because when there is trauma, there can occur an excessive blood loss, and when there is a heat stroke, okay, and blood loss, and when there is certain kind of allergic reaction, severe infection, poisoning, severe burn, or other causes, okay. So these are the result, or you can also simply call it as a cause. Means ये सब का वजह से shock हो सकता है. Means like because of trauma, because of heat stroke, because of blood loss, because of allergic reaction, because of severe infection, because of poisoning, because of severe burn. Okay, and there are several other causes. So these are the certain causes, okay, that can result in the development of this shock. So when a person is in shock, his or her organs aren't getting enough blood or oxygen. So obviously when there is a sudden drop in our blood flow now, so at that time what happened is that can lead to disruption of blood supply. Okay, there can be disruption of blood supply, means the amount of blood that we need to receive, okay, that we won't be receiving. Our organs will not get enough blood or oxygen, okay, because of this sudden drop in the blood. Are you getting me? Are you getting me?
Yes, ma'am.
Okay, so what happened is that, as you know, that shock can lead to shock is the condition where it occurs because of sudden drop in the blood flow, right? So if these remain untreated, then that can lead to different damage in our organ. So it can lead to permanent organ damage also. So not only the organ damage, it can also eventually lead to like death. Okay, so when you find someone in a critical condition, that is shock, okay, so immediate or primary treatment or early treatment is very, very much essential, okay, so to prevent from all these kinds of problem or any further problem. So are you clear what is shock? What is shock?
Yes, ma'am.
Okay, so let's move on. So these life-threatening conditions, so we call this shock as a life-threatening condition, okay, because it can eventually lead to death, okay. So these life-threatening condition occurs when the circulatory system fails, and as a result, vital organs such as the heart and the brain are deprived of oxygen. So our vital organs, now whatever vital organs we have, such as the heart and the brain, okay, they are deprived of oxygen, they are lack of oxygen. Obviously when there is a sudden drop in our blood, okay, so there will be a This one, there will be a failure in our circulatory system also, because circulatory system, how the blood should flow and all that, it won't be able to flow in that way. So that will lead to disruption of the vital organs such as the heart, the brain, okay, and all these heart, brain, that vital organ, they will be lack of oxygen, okay. So it required emergency treatment to prevent permanent organ damage and death. So that is why we call it in the first line as critical condition, because emergency treatment is needed for all this condition, okay, because it is not a simple condition, okay. It is not a it is not a primary, or it is not a, how to say it is not a like acute, okay. It is very much chronic, it is very much severe. So that is why like emergency treatment is very much essential. So shock can be made worse by fear and pain. So what happened is that like there is already a sudden drop in the blood flow, okay, which led to shock. So in the same way, if you are very afraid, or if you are in so much of pain, that can make the condition worsen, okay, that can make the condition more and more weak. So so we should always advise the casualty or the injured person, okay, to not to be fair, not to like feel so much of pain, okay, during this shock. Otherwise the condition can get very much worse. So whenever there is a risk of shock developing, reassure the casualty, making him comfortable and keeping him warm may be sufficient to prevent him from deteriorating. So this is what I have already explained in a simple way, that while having a shock, the person should not be in fear or in pain, because being in fear or pain can worsen the condition. So what is our duty? Our duty is to reassure the casualty and to make him comfortable, okay, and to always keep him warm, okay, so that this can like prevent him in getting fear or in getting pain, okay, and so that and the condition also will not get worsened. Are you clear with the introduction part of the shock? Are you clear?
Yes, ma'am.
Okay. Okay. Carly, can you hear me?
Yes, ma'am.
Yeah, what did I explain in the introduction part?
About the shock, ma'am.
Yeah, then what did I explain? In a simple
It is a critical condition where blood flow is dropped, ma'am.
yes, sudden drop of blood. Okay, very good. And then what are
this may
the causes and all?
it could be a trauma, heat stroke,
Yeah, very
allergic
good.
reaction.
Yes, very good. Okay. Okay. So when you are means when someone is on the condition of shock, okay, in a critical condition of shock, so he or she need to be in a pain or like whatever it is.
No, ma'am. He should be calm.
Yeah, very good.
Yes.
Okay. What else?
He should be calm and not feel fear or pain.
Okay.
Otherwise, this is yes, ma'am.
Okay. Okay. So if there is a as we know that shock is the sudden drop of the blood flow, right? So if there is sudden drop of the blood flow, that can shock lead to a can shock damage our organs? And
Yes, ma'am.
yeah. Okay, because why it can lead to like organ damage? Because all our organs, whatever organs that we have now, all they need the adequate blood supply and oxygen now. So when they don't get enough blood supply and oxygen, they will get like damage. Okay, so and also eventually can lead to death when there is damage in organs. That is all about the introduction of the shock. So all of you are clear, right? What is shock? If yes, I'll move on.
Yes, ma'am.
Okay. Next, causes of shock. So let us see what are the conditions that can cause shock. So first is the hypovolemic shock. You can write it down if you want to write it down, just the point. Causes of shock, number 1 is hypovolemic shock. So causes of shock, so what hypovolemic shock, so let us discuss what does hypovolemic shock means. Okay, so the most common cause of shock is severe blood loss that we already know. Okay, so if the blood loss exceed 1.2 liter, okay, so if the blood loss exceed 1.2 liter, this is about 1/5 of the normal blood volume of an adult. Means 1.2 liter is the it is about 1/5 of the normal volume of an adult. Okay, blood volume of an adult. So what happened is that if we lost blood, okay, if our blood loss exceed more than it's 1.2 liter, or if it is more than 1.2 liter, okay, then what happens is that there is a chances of developing this shock, okay, which we call it as hypovolemic shock. So the blood loss may occur due to external or internal bleeding. So we don't know now, from which category the blood loss occur, from the external or from the internal bleeding. So the blood loss might be due to external bleeding or else internal bleeding. And then there are also certain other conditions where loss of body fluid can result. Okay, so the condition that cause heavy fluid loss include diarrhea. Okay, so the first condition was that the blood loss that used to occur is not that can be due to external bleeding or internal bleeding, but the other one is that there is other condition also, okay, where fluid used to be lost from our body. That is condition like diarrhea, severe burn. Okay, diarrhea, all of you know na, diarrhea and severe burn. So when burn occurs, it's not it when you have a burn and the burn is very much severe. So obviously that when burn is severe, then the fluid will keep on, you will keep on losing the fluid now. So at that time, and that is also the condition where this shock can also result. So that is the other condition how fluid loss occurs. Are you clear with hypovolemic shock?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, let me repeat once again. Okay, hypovolemic shock. So hypovolemic shock, this is the most common cause of shock in severe blood loss. Okay, if our blood loss, if it exceeds 1.2 liter, then that might there might be a chances of developing shock. Okay, and this shock might be means this bleeding. Okay, this blood loss might be due to external or internal bleeding. And there are also some other condition, okay, where we can lose our body fluid. Those conditions are like if you have a severe diarrhea, if you have a severe burn, okay, those are the conditions that can lead to a shock known as hypovolemic shock. Next is cardiogenic shock. So cardiogenic shock. So shock may occur when an adequate volume of blood is available, but the heart is unable to pump the blood around. So cardiogenic shock means shock ka matlab cardio, from the name itself cardio, we can know that it relates to the heart, right? So what happens is that you know that there is already excessive loss of blood already occur, but what happens is that there remains still an adequate volume of blood is still available. Okay, means when an adequate volume of blood is still available, but our heart is unable to pump the blood around it. Okay, so this problem can be due to like severe heart disease, heart attack, or acute heart failure. So in hypovolemic shock, what we find is that whatever shock that occur in hypovolemic, it mainly relate to the severe blood loss. Okay, blood loss or fluid loss, whatever fluid it is, any kind of fluid loss, because from the name itself, volume, the matlab fluid loss, okay, that you can know. But in the cardiogenic shock, our heart will be unable to pump the blood, okay, which is around it. And why our heart is unable to pump the blood? Because of the like severe heart diseases. There are so many like heart diseases and all. Okay, maybe because of heart attack, maybe because of acute heart failure, or maybe because of chronic heart failure. So whatever it is. So these are the conditions where we can get cardiogenic shock. So are you clear the difference between hypovolemic shock and cardiogenic shock?
Yes, ma'am.
All of you?
Yes, ma'am.
Yes, ma'am.
Okay, so there are also certain other type of shock, which is very important. Okay, other types of shock. So there are other causes of shock, which include like septic shock. Okay, so septic shock. Septic का मतलब है जो infection होता है ना. So other causes of shock like this overwhelming infection. If there is so much of infection. Excuse me, if there is so much of like infection, overwhelming infection, okay, that can also means too much of infection can also cause shock, which we call it as septic shock. Okay, then there is also like another like certain kind of shock, which we call it as like metabolic shock. Okay, metabolic shock means hypoglycemia, when we have low blood sugar level. It's not it, because when we have high blood sugar level, then that can lead to a condition known as diabetes. Okay, so but when there is a low blood sugar level, which we call it hypoglycemia. Okay, hypoglycemia. So अगर इंसान का शरीर पे बहुत ज्यादा sugar कम होगा, so that can also lead to a shock, and the name of that shock we call it as metabolic shock. And if there is a lack of certain hormones, okay, we have so many hormones in our body, it's not it, which we keep on discussing several kinds of hormones. So if there is lack of certain hormones, low blood pressure, and all these condition can also be condition can also cause shock, which we call it as metabolic shock. Are you clear what is septic shock, metabolic shock? Yes or no?
Yes, ma'am. Yes, ma'am.
Okay. There is also again there is also another respiratory shock. Okay, like undercooling, that is hypothermia. Hypothermia, what is hypothermia? Anyone? Hypothermia. Hypothermia.
Low body temperature, ma'am.
Very good. So when there is a low body temperature, that is undercooling. Undercooling means low body temperature, that is hypothermia. And then injury to the respiratory tract or lungs. Okay, and if there is injury to the respiratory tract or lungs, okay, then we call it as respiratory shock. We call it as respiratory shock. Are you clear? Means a condition like when you're having a low body temperature, and when there is injury in your respiratory tract, when there is injury in your lungs, that will cause a condition, or that will cause a condition called respiratory shock. So are you clear?
Yes, ma'am.
Yes. Yes, ma'am.
There is also another shock, okay, that can occur due to the allergic reaction. So अगर शरीर पे बहुत ज्यादा एलर्जी है, okay, and वो जो एलर्जी है वो बहुत सीवियर है, वो बहुत ज्यादा है, so severe allergic reaction, then we call that allergic reaction can also create shock. Okay, and the name of that shock is anaphylactic shock. This shock is very much common, and it's also like important. Okay, anaphylactic shock. So anaphylactic shock is the shock, or it is the condition that occur due to severe allergic reaction. Are you clear?
Yes, ma'am.
Okay. Next is neurogenic shock. Okay, neuro means what? Neuro. What is neuro?
Nerves, ma'am. Nervous system.
Okay. What about others? What is neuro?
Injuries body.
What is neuro? What is neuro? Neuro means, neuro itself is the nerve and our nervous system. Okay, this we in short we can simply call it as neuro also. So when a person take an excessive intake of drugs, okay, that is drug overdose. when you inhale or when you take an excessive drugs, that is overdose drugs, okay, and when there is injury in your spinal cord, okay, so this can also lead to a condition called as neurogenic shock. अगर 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 किसी इंसान ने बहुत ज्यादा ड्रग्स ले लिया, okay, drugs doesn't mean only that particular drugs, okay, drugs indicate all kinds of medicine, कुछ भी medicine हो, we call it as drugs. So any kind of medicine or any kind of drugs, if someone intake overdose, okay, and then he can, and that condition, that overdose condition can lead to a shock known as neurogenic shock, and the other one is if there is injury in our spinal cord ना, तब भी shock हो सकता है. So वो shock का नाम है neurogenic shock. So let us revise whatever we have discussed. The causes of shock, that is hypovolemic shock. So hypovolemic shock कैसा होता है? Like this is the shock जब severe blood loss, शरीर से जब बहुत ज्यादा blood loss होता है, okay, और जो blood loss है, if it exceed 1.2 liter, okay, 1.2 liter से ज्यादा हुआ तो that can lead to shock, okay, and ये जो blood loss है ना, कैसे loss होता है? It may be due to external bleeding, it may be due to internal bleeding. ये blood loss कि external bleeding और internal bleeding का साथ साथ there is also other condition, दूसरा तरीका भी होता है, okay, that can like means where we can have blood loss, that is it include diarrhea. अगर किसी का diarrhea हुआ ना तो बहुत excessive fluid loss होगा, और severe burn होने से भी बहुत excessive fluid loss होगा, so that can lead to shock. Next, cardiogenic shock. Cardiogenic shock पे हमको पढ़ने को क्या मिला? In cardiogenic shock, we know that there is adequate amount of blood is available in our body, but what happens is that our heart is not like, is unable to pump the blood, okay, even though we have enough sufficient blood, but our heart is unable to pump that particular blood that is available, okay. Why our heart is unable to pump? Because our heart is having severe diseases, okay, or severe heart attack, or it might be having a acute heart failure. That is why our heart is unable to pump the blood. So, and when this condition happen, it can lead to a shock known as cardiogenic shock. Or दूसरा type का shock also we studied, that is if shock occur because of infection, we call it septic shock, okay. If shock occur because of lack of certain hormones, अगर शरीर पे sugar level बहुत कम हुआ, तो we call it as this low blood sugar level is known as hypoglycemia, okay. अगर blood sugar high है तो we call it as hyperglycemia. So when there is lack of certain hormones in our body, when there is a low blood sugar level, okay, then that can occur a condition known as metabolic shock. Or agar sharir pe, like you have a low body temperature and you are also having an injury in your respiratory tract, in your lung, then that can also lead to a condition called respiratory shock. And you can also have a shock that is anaphylactic shock. This anaphylactic shock occur because of severe allergic reaction. Okay, and when you take overdose of drug and when there is injury in your spinal cord, then there can also be development of a shock, which is known as neurogenic shock. Are you clear? Causes of shock?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. Coming to the next. Okay, next is you might observe the following symptoms. So when someone is having a shock now, so let us discuss what are the type of symptoms that you might observe. So first is initially, what type of symptoms you can observe initially. The pulse will be rapid, okay, rapid pulse, and then pale look. The face or the body will look very pale, and then cold, clammy, sweaty skin. So you will see, because there will be an excessive fluid loss, blood loss or any kind of fluid loss, okay. The fluid can be lost through your sweat, or fluid can also be lost to the external and internal bleeding, right? So blood bleeding of the blood. All those can also be the one condition where the fluid is lost. And if you sweat too much also, like if you sweat too much also, your fluid is lost, right? So these are the condition symptoms you will find. So cold, clammy, sweaty skin. Obviously, hypothermia हुआ, body temperature low हुआ, cold, clammy, sweaty skin you will find. अगर बहुत ज़्यादा blood loss होने से तो the face and the skin, everything used to look pale, okay? And there will be a rapid pulse. These are just the initial condition. So as shock will develop, what will happen? Okay, let us see. There will be rapid shallow breathing. So the breathing pattern also will be very, very fast. Okay, there will be a rapid breathing and like rapid as well as shallow breathing. Both it will occur. So and then same thing, cold, clammy skin. There will be rapid as well as weak pulse. Okay, कभी-कभी ऐसा लगता है कि pulse सुनाई ही नहीं दिया. The pulse is very weak. Sometimes you find that the pulse is very rapid. So both the rapid and weak pulse are the conditions or the symptoms of shock. Okay, and dizziness or fainting. So when someone have excessive fluid loss, excessive blood loss, okay, obviously उसका चक्कर आएगा ना, बहुत ज़्यादा fluid loss हो गया तो चक्कर आएगा. तो dizziness or fainting, all these are the symptoms you can find. And the other one is weakness. Obviously, person will find weakness. Are you clear? Whatever we have discussed this, because I won't repeat again. Initially,
Yes, ma'am.
okay.
Yes, ma'am.
Let's move on. So next is the eyes appear to stare. So when you know now, when you stare something, you keep on staring and looking that particular things. Na? So the eyes appear to stare. So the eyes will appear to stare something. जब इंसान shock में हो जाता है ना, तो एक चीज देखने से like keep on staring that particular thing. So all this condition, all these symptoms you will find, okay, in a shock patient only. And then anxiety or agitation. So anxiety होता है वो anxiety. All of you know now what is anxiety? Anxiety? What is
Yes, ma'am.
anxiety? What is anxiety? I hope you can't explain, but you understand the term, right?
Yes, ma'am.
Okay. And what is agitation?
Getting angry.
Agitation means? Agitation means
Getting
like,
angry quickly, ma'am.
yeah, getting angry quickly, or like what to say, like excitement or whatever it is, nah? So all those it means feeling. You can also call angry, irritated, or a person is feeling very restless. So all these are the symptoms you will find in a shock patient. वो बहुत irritated feel होगा, restless feel होगा, like गुस्सा बहुत जल्दी होता है, or anxiety. All these are the condition you will see. Jivan, please take attendance. Only 8 minutes left. Okay, so let's move on. Next is seizure. Seizure. Have you heard the term seizure? If no, I'll explain. Hurry up.
Yes.
Okay, seizure क्या है? Explain करो तो. What is seizure? Explain first. If not, I will explain. What is seizure? Okay, seizure का मतलब है ना, there will be an abnormal body movement. So seizure can be like, seizure is also known as convulsion. Okay, we also call it as convulsion. Okay, this is totally abnormal movement, like hand कांपता है ना, automatically your hand will shiver, your hand will shake, your head will shake, like your leg will shake. Sometimes what happens is that the whole body also shivers, sometimes only the hand, sometimes only the leg. पूरा abnormal body movement होगा, that we call it as seizure. Are you clear?
Yes, ma'am.
कुछ activity
Yes,
और कुछ uncontrolled activity ऐसे खुद ब खुद perform करेगा, तो उसको बोलते हैं seizure. So if someone is having shock, there is a chances of developing seizure. So always remember this Caesar. It's very, very important. We also call it as convulsion. Convulsion. So confusion or unresponsiveness. So इंसान शॉक में चले जाने से वो बहुत confusion में रहता है, बहुत unresponsive होता है, कुछ बात करने से भी response नहीं देता, तो बहुत unresponsive होता है. And then low or no urine output. So वो urine pass करने में भी उसका urine बहुत कम होता है या फिर urine pass ही नहीं करती. Like the urine output might be very less, or he might not pass urine at all. So these are the conditions you would see in a shock patient. Then bluish color lips and fingernails. His or her fingernails and lips will be bluish in color. Okay, when we have, like when our excessive fluid loss occurs in our body, na, then what happens is that अगर किसी का एनीमिया हुआ तब भी क्या होता है, उसका शरीर पिल हो जाता है ना. So in the same way, the bluish lips and fingernails, lips वगैरह ये सब में bluish color form होगा. So these are the condition. And sweating, all of you know sweating, nausea and vomiting might also occur, and then the casualty might feel very thirsty. So obviously अगर हमारा शरीर पे बहुत ज्यादा fluid loss होगा तो obviously we will feel thirsty ना. So the casualty might feel thirsty, okay? And the other condition is the casualty might become restless and aggressive, same thing. And then the casualty might complain of chest pain. जब shock होता है ना तो chest pain होने का बहुत ज़्यादा chances होता है. So the casualty sometimes might complain that I am having a chest pain. So are you clear till here? Whatever we have discussed today?
Yes, ma'am.
Yes, ma'am.
Okay, so what we have discussed today? Shock, about the introduction of shock with very briefly, and then causes of shock, hypovolemic shock, and cardiogenic shock, and there are certain other type of shock that was all of these. That is septic shock. You can write one by one, okay? Like खुद अपने लिए लिख लेना, like किताब पे कि other type of shock भी होता है, जैसे कि septic shock number 1, number 2 metabolic shock, number 3 this respiratory shock, number 4 anaphylactic shock, number 6 like neurogenic shock. ऐसा करके लिख सकते हैं so that it will help you in like memorizing easily. And next are the like what are the signs and symptoms, you will observe all these things. So you are clear, right? Whatever we have discussed today, everything, every point.
Yes, ma'am.
Yes, ma'am.
Okay, so next will be your next will be your practical class now. So in practical class today, like whatever I have taught you all now on that day now, like I will be asking questions based on the previous class. So all of you revise, okay? That day I have discussed about ABC, right? That day I have discussed, I still remember resuscitation and all those meaning and all I have explained. So Jivan, are you done with attendance?
Yes, ma'am.
Okay, then that's all for today. Thank you, everyone.
Thank you, ma'am.
Thank you, ma'am.